What is obesity? By definition, it is having excess body fat and being beyond overweight. There are many reasons why we become obese. It's not just overeating. Medications, mental disorders, and even our genes matter. The question is, what can we do about it? Obesity is a growing problem in the United States. Soon, more than half of all Americans will be obese. That's over 150 million people. And obesity is harmful if it is not treated, because it causes diseases such as diabetes, heart disease, stroke, and even cancer. In fact, obesity, like smoking, is a leading preventable cause of death. Fortunately, if you are overweight or obese, there are things you can do to improve your health and lower your risk of getting these harmful diseases. As little as 5% weight loss can provide significant health benefits. And your healthcare provider is here to help you. But first things first. How do we know if we are obese? You've probably heard the term BMI, or Body Mass Index. BMI is a measurement of body fat based on height and weight for adult men and women, and is considered a more accurate measure than weight alone. A BMI of 26 to 29.9 is considered overweight. A BMI of 30 or over is considered obese. Your healthcare professional can help you calculate your BMI. It's important to remember that BMI alone is not completely measuring body fatness or your health, but it can help determine your healthy weight. Now, do people with the same BMI have the same level of risk? Not exactly. For example, stronger, heavy-set men and women with excess muscle are not always at high risk, even if their BMI is high. So what does increase the risk? It has to do with the location of the excess fat. If you have excess belly fat, you are always going to be at a higher risk of disease regardless of BMI. What about having fat in other parts of your body? Having some body fat in the arms and thighs is fine, but having too much body fat around your middle, in the abdomen, leads to health problems. How can you tell if you have excess fat around your middle? The first test is to measure your waistline at the belly button. If the measurement is more than 35 inches for women and more than 40 inches for men, then the risk of disease is high and it's time to do something about it. Let's talk about next steps. First, healthy eating habits and exercise are key to reducing belly fat. Second, you may have to change other lifestyle habits in order to keep the weight off, such as changing what you drink, managing your moods, and getting a better night's sleep. Additional steps may include medications, surgery, and psychological counseling. And finally, you need to work with your healthcare professional to understand if you are at risk for diabetes or heart disease, and to determine next steps to lower your health risks. It's never too late to change and adopt a healthy lifestyle. If you are diagnosed with diabetes or heart disease, or both, because of excess belly fat, you can control your future. Losing weight through a change of diet and exercise can help prevent future complications, such as heart attack, stroke, or kidney failure. Your provider may also recommend medication to help avoid these complications. Now is the time to speak with your healthcare professional about treatment choices. Let's review. Some body fat is normal. Obesity is having too much body fat in comparison to your weight. With over half of Americans soon to be considered obese, it has become a national problem. Your BMI, or body mass index, can help determine if your weight is at a healthy level. Although some body fat is fine, too much belly fat can result in other health complications, including diabetes and heart disease, even if your BMI is not high. As little as a 5% weight loss can have a huge benefit to your overall health. Healthy eating habits, exercising, and a change of lifestyle are great first steps in reducing the problem. It's possible that your provider may also recommend changes in your medications, surgery, or psychological counseling to avoid future health problems. Be sure to speak with your healthcare professional about the options that are right for you. Thanks for watching. We hope we've answered some of your questions. Your provider will be with you shortly to continue the conversation about this important topic.